So as we have discussed unclassic inheritance, and if you remember, we started our discussion like genetic disorders, single gene, multiple, and then chromosomal disorders, right? So now we are going to discuss chromosomal disorder. But before we start chromosomal disorder discussion, let's have some understanding about chromosomes. Have some understanding about chromosomes, right? We all know that a study of chromosome is called as karyotyping. So first we will discuss about karyotyping. Study of chromosome is called as karyotyping. What is karyotyping? We know study of chromosomes, and when we are studying chromosomes, we prepare a karyotypic ideogram. In karyotypic ideogram, there will be a presentation of the chromosome. So karyotypic ideogram will be like this, where we will be presenting chromosomes, all 23 pairs of the chromosomes, right? So how will be the presentation of the chromosome in karyotypic ideogram? That is also one important question, right? So here we must understand chromosome will be arranged in pairs. So what I am showing you, chromosome will be arranged in pairs. So paired arrangement, number one. So chromosome will be having paired arrangement. So chromosomes are arranged in pairs, number one. And second thing, you will notice that they are decreasing order of the length. So they are arranged in decreasing order of the length. So their length is decreasing, right? So paired and decreasing order of the length. So in any karyotypic ideogram, whenever you will see the chromosomes, they are in decreasing order of the length and they are paired. So where you will keep the sex chromosomes. So remember that sex chromosome, XY chromosomes will be present in the end. So XY chromosome will be present in the end of the karyotypic ideogram. So in any karyotypic ideogram, chromosomes are arranged in pairs in decreasing order of the length, and after autosomes are arranged 22 pairs, 23rd pair, which will be the sex chromosome, will be in the end, right? So this is the karyotypic ideogram. So if you see the karyotypic ideogram and examiner is asking one question, which chromosome is the largest chromosome? Which chromosome is the largest chromosome? So remember, largest chromosome is chromosome number 1, which we are seeing here, right? So largest chromosome is chromosome number 1. This was the DNB question in 2014. So examiner may ask this question, which is the smallest chromosome? So now which is the smallest chromosome? This question will be little atypical because it is neither X nor Y, right? It is neither X nor Y, and even it is not chromosome number 22 also, right? So remember, it is chromosome number 21, which will be the smallest one, right? So here we have to understand chromosome number 21 is the smallest chromosome. So these are the two basic questions which examiner had asked in question, and one we can expect in future exam. So smallest chromosome will be chromosome number 21, right? Now we are going to see that these chromosomes, when we are going to study karyotyping or chromosomal study, what are the samples we are going to collect and how we are going to proceed, right? So which sample is used for the karyotypic study? So what are the samples we are going to use for karyotyping? So which sample we are going to use for karyotyping? Number one, we will be using amniotic fluid, right? So we'll be using amniotic fluid. In amniotic fluid, what will be there? In amniotic fluid, you will be having shedding of the epithelium. So this is important to understand what we are going to study in any amniotic fluid. So it will be shedding of the epithelium. Which epithelium? Shedding of the epithelium from the skin, right? GIT or urogenital tract. So all these organs, they will shut down their epithelium into amniotic fluid for karyotypic analysis, right? So that is the important thing which we have to keep in mind. So number one sample is amniotic fluid. Second sample which we can use is the chorionic villi biopsy, right? So second sample which we are using very frequently is the chorionic villi biopsy, right? So chorionic villi biopsy will be used. Third sample, we can use peripheral blood, and in peripheral blood only one cell which we can use is the lymphocytes, right? So we can use lymphocytes. So lymphocytes are used because they will proliferate inside the test tube. So in vitro proliferation is possible only with the lymphocytes. That is why it is only used for the karyotypic analysis. Other cells will not proliferate. That is why examiner they ask question. So just remember, this is the very frequently asked question. Which cell is not used for the karyotypic analysis? Lymphocytes or monocytes, right? So we have to remember monocytes are not used, right? So monocytes are not used. This was the All India question, right? So monocytes are not used for the karyotypic analysis. That was the question in All India exam, right? So monocytes are not used for the karyotypic analysis. What we are going to use in karyotypic analysis? Lymphocytes will be used, right? Now there was a question in All India exam 2014. Can we use fetal tumor samples? Can we use fetal tumor sample? Answer is yes, we can use fetal tumor sample also. So that was the question in All India exam. So we have to keep that in mind. Fetal tumor sample can be used, right? Here I would like to tell you one important question which examiner had asked in All India exam. What is the most common fetal tumor? What is the most common fetal tumor? Teratoma, right? So here we have to keep that mind. Most common fetal tumor in human being is teratoma. So most common fetal tumor in human being is teratoma, and that is what I was telling you. This was the question in All India exam, right? And this teratoma sample can be used for the karyotypic analysis. So keep that in mind. If examiner says fetal teratoma sample can be used for karyotyping, answer will be yes. Fetal tumor samples are used, and most common fetal tumor is teratoma. So this will be also used for the karyotypic analysis. Another question which was asked in All India exam was chordocentesis. Chordocentesis, this is the terminology which has been used. Chordocentesis means ultrasound guided blood sampling of umbilical cord blood vessel, right? So umbilical cord blood vessel. So when we are doing ultrasound guided blood sampling of the umbilical cord blood vessel, that is called as chordocentesis, and this chordocentesis was All India question also. So these are the 5 important samples we are using for karyotypic analysis, right? So always remember, it is shedding of the epithelium into amnion, chorionic villi biopsy, fetal tumor sample, peripheral blood lymphocytes, and USG guided sampling of the umbilical cord blood vessel, and that is called chordocentesis. So you have taken the sample, or we have taken the sample. After sample has been taken, then we cannot perform all the sample on the same day. So we need to fix them also. So what will be ideal fixative for karyotyping? That was the question in All India exam and DNB exam. Ideal fixative for karyotyping. So that is another important thing which we have to remember. Okay, what are the fixatives of the choices? Fixatives of choice. This is the topic which is nowadays very frequently asked in all exam. AIMS, All India, PGI, all exam they are asking question from this topic. So I am just taking out some time out so that I can tell you all those important MCQs which examiner can ask from this topic called fixatives of choice. So number 1 which I want to tell you, fixatives of choice which we are discussing right now is the karyotyping. So what is the fixative of the choice for karyotyping? When examiner will be asking you, when examiner had asked, that time answer was methanol, right? So that time answer was methanol is the fixative of the choice. But remember, it is not only methanol, it is methanol plus glacial acetic acid. Methanol plus glacial acetic acid. So here we should understand few important things. Methanol and glacial acetic acid, which are fixative of choice for the karyotyping, there is a one commercial name for them which examiner can ask in future exam. So that is also important to understand. What is the name of this fluid where methanol and glacial acetic acid is mixed? That is called as Carnoy's fluid. That is called as Carnoy's fluid. So examiner may ask this question in exam. What is Carnoy's fluid? It's a mixture of methanol and glacial acetic acid. right? So Carnoy fluid is the best or best fixative for the karyotyping sample. So that is the important future question which we can anticipate in exam. Methanol was the older All India and DNB question. So see, methanol is older question, and now for future we have to keep that Carnoy fluid in our mind. So this is about karyotyping. Now the coming is the another important thing for histopathological examination. This was the All India and AIMS both question. Histopathological examination. So in histopathology, what is the ideal fixative? It is 10% of the formalin. So 10% of formalin is the best fixative for the histopathological examination, right? So 10% of formalin is the best fixative for histopathological examination, right? What will be the best fixative for electron microscopy? This was the question in previous year PGI exam. PGI exam question was like this. This was the statement, right? This statement was taken from the AIMS question 2012, right? So that statement is electron microscopy, glutaraldehyde is the best fixative. True or false? So answer is yes, they are true statements. So for electron microscopy, glutaraldehyde is the best fixative, right? So for electron microscopy, glutaraldehyde is the best fixative. This was the PGI and AIMS both MCQ, right? Now coming to the another previous year AIMS question. Question was, what is the ideal fixative for the cytological preparation? For the cytology, or examiner may ask in terms of pap smear, because pap smear, where we are making pap smear in obs and gynae ward, right? Obs and gynae OPD, when patient is coming and we are going to screen for the cervical cancer, we will take out this slide, we will make a smear from the cervix, and that is called pap smear, which is a cytological smear. So for any cytological things, what is the best fixative? Answer will be 95% of the ethanol. So 95% of ethanol is the best fixative for the cytological specimen like a pap smear, right? Now coming to the another beautiful question, which was little controversial question in AIMS exam. What is the use of, what is the best fixative for the testicular biopsy? Testicular biopsy, right? This was the question in AIMS 2016. And remember, there should be no controversy. Testicular biopsy, when examiner is asking you what is the choice or what is the best one, so when examiner is talking about the best one, your answer should be Bowen's fluid. Your answer should be Bowen's fluid. Bowen's fluid is a picric acid, right? So picric acid name was also asked in older JIPMER exam. So Bowen's fluid or picric acid is the ideal fixative for the testicular biopsy, right? So remember, ideal fixative or best fixative. But if examiner says, okay, what is the universal fixative, right? What is the universal fixative? Then your answer should be 10% formalin. So we should not get confused with the best versus universal fixative, right? Because this is how it has been given in a one book, which is the histotechnic book called Bancrofty, right? So Bancrofty, it is given as a universal fixative is 10% formalin, which we should not get confused with the best fixative, which is Bowen fluid, and this Bowen fluid is given in urology textbook, right? So Campbell urology, when you will read, you will find Bowen fluid has been mentioned as the best, right? So these are the references for this controversial question. Campbell urology book, which was published in 2016, they have written it, Bowen's fluid is the best fixative for any testicular biopsy, because testicular architecture will be, histological architecture will be more preserved in Bowen fluid in comparison to the 10% formalin, right? So this point we have to keep in mind. Now this Bowen fluid is also used for, Bowen fluid is also used for reticuloendothelial cells. Reticuloendothelial cells, right? So it is also used for reticuloendothelial cells, and it is also useful for hematopoietic cells, hematopoietic stem cells. So hematopoietic stem cells, this was the question in DNB exam 2015. Hematopoietic stem cells, which of the following will be the best fixative? So hematopoietic stem cells, best fixative will be picric acid, right? So these are the important points about fixative, right? So that is why I wanted to tell you that fixatives are the very important question nowadays. And now in karyotyping, ideal fixative will be methanol plus glacial acetic acid, which is called as cornoise fluid, right? So now we have taken the sample, we have fixed them in cornoise fluid, and after some time we will see the karyotyping. For seeing karyotyping, first we will allow them to proliferate, right? So now cells are proliferating, and cell proliferation, when it was going on, then you will perform metaphase arrest. Then we will go for metaphase arrest, right? So at this metaphase arrest only routine karyotyping is done. Remember the word which I am using, at metaphase arrest only routine karyotyping is done. So when cell was proliferating, routine karyotyping is done by metaphase arrest, and metaphase arrest is done by which alkaloid? Another important MCQ, colchicine alkaloid. So this colchicine alkaloid is responsible for metaphase arrest, right? So this is another important MCQ. Colchicine alkaloid is responsible for metaphase arrest, and metaphase arrest is used for routine karyotyping. So this is another important point we have to remember. This is used for routine karyotyping. So in routine karyotyping, we are using metaphase arrest. Cell will be arrested in metaphase by adding alkaloid known as colchicine. What is the drawback? Drawback of metaphase arrest is we can see only limited bands. So you can see only 400 to 800 bands per karyotype, right? So you can see only 400 to 800 bands per karyotype. So this is a very small kind of unit. So to improve this resolution, so this is resolution of the karyotyping. So resolution is very low. This resolution is very low. So how we can improve the resolution? This was the another beautiful question in exam. So how we can enhance the resolution? To enhance resolution, we should go for prophase arrest, and that was the question in DNB and All India exam. So prophase arrest is required for increased resolution. So when we are doing prophase arrest, resolution will be increased up to 1500 bands. It will be increased up to 1500 bands per karyotype, right? So this is how we have to understand routine karyotyping. Metaphase arrest is done where resolution is very low, up to 400 to 800 bands, but in prophase arrest we will be seeing 1500 bands. So resolution has been increased. So after this, when cells are arrested, and then we will be using one special stain to identify the regions of the chromosomes. So which is most common and best stain for karyotyping? Now the question is, which is most common and best stain for karyotyping? Most common and best. So most common and best stain for karyotyping. So your answer is Giemsa stain, right? So it is Giemsa stain which is best for the karyotyping, and that is why sometime karyotyping is also called as G banding, right? So that is why it is called as G banding. So whenever we are doing this, this is called as G banding, right? So now we have to understand Giemsa stain is the best and most common used stain for the karyotyping of the chromosome. So this is how we are going to study about the chromosome. And when we are studying about the chromosome, what we will notice that chromosome is divided into two parts on the basis of centromere in the center, right? So now I am showing you, this is the centromere. On the basis of centromere, chromosome has been divided into two parts. One is the short arm, see, two arms. So I am showing you chromosome has been divided into arms. Short arm is called as P. P is short arm. Then long arm is Q, right? Q is long arm, right? P stands for, remember, P stands for petit. P stands for petit, right? And Q is the next alphabet in the dictionary to the P. So next to P is the Q, and that is why we use the term Q. So short arm is the P. Always remember this point. Short arm is the P, long arm is the Q. So on the basis of the centromere, we have divided chromosome into short arm and long arm. So short arm is P, stands for petit. P stands for petit, and Q, it's the next alphabet to P. That is why it has been given name of Q. So any chromosome, how we divide? So I will just explain you. Chromosome, first they will be having divided in arms. Arms will be divided into regions. Regions will be divided into bands, and bands will be divided into sub-bands. Right? So this is how we divide a chromosome. Right? So this is the real and ideal karyotyping which we see. Chromosomes are divided into arms are divided into regions are divided into bands, and bands in sub-band. For example, when we are talking about the long arm, so suppose I am taking one example, just I am giving you one example. Suppose I want to show you karyotyping of the chromosome number 13q14.2. Suppose this is the chromosome, and I wanted to demonstrate how nomenclature is done for a chromosome and what are the significance of these things, right? So now this significance shows that chromosome number is 13, right? So 13 is the number of the chromosome. Q, you can easily make it out, it is the arm, long arm. What is 1? Region. What is 4? Band. And what is 2? Sub-band, right? So this is how I am going to demonstrate, right? This is the chromosome, and this is the long arm. This is the short arm, this is the long arm, right? So first what I have shown you, there is a arm, right? So you can see arm is Q, right? So arm is Q. Now this arm has been divided into region. So this chromosome will be divided into regions, right? So these are the regions. So in red color, what I am showing you, these are the regions. So arm is divided into regions, and in the region, then you will see inside the region there will be band, right? So this is the band, right? So what I'm showing you here, this is the band, right? So what I'm showing you here, this is the band, right? So arm, region, band, and within the band you will see there will be sub band. So these are sub bands. So this is the sub bands. So this is how we divide a chromosome: arms, region, band, and sub band. So you can see, now we can see that what is this 1? See, this is the arm. 1, see, arm is Q, region is 1, 4 is the band, and 2 is the sub band. So this is how we get conclusion of this kind of karyotyping. So whenever it is written like this, 13q14.2, we must understand 13 is the number of chromosome, Q is the arm, which is long arm, 1 is the region, 4 is the band, and 2 is the sub band. So this is how we do a simple nomenclature of the chromosome. So on the basis of the centromere, we can divide chromosome into 4 subtypes, right? So there are 4 types of the chromosome. Now I am going to divide chromosome 4 types. So we are going to see 4 types of the chromosome on the basis of centromere, right? So this is on the basis of centromere. So number one, when centromere is exactly in the center, mean to say that short arm is equal to the long arm. So length of short arm is equal to the long arm. This is called as metacentric chromosome, right? So this is called as metacentric chromosome, right? These are metacentric chromosome. Second group of chromosome, when you are seeing this centromere is slightly away from the center. Suppose this is the central part, right? Suppose this is the central part which I am writing here, central part, but here centromere is away from the centromere. So this is the long arm, which is slightly longer than short arm. So when centromere is slightly away from the central part, this will be called as submetacentric chromosome. Submetacentric chromosome, right? Submetacentric chromosome, I would like to tell you one important mnemonic. Submetacentric, just this meta spelling I am going to change, right? I am going to change the meta spelling as a M-A-T-A, mata, right? Sub mata, sub in Hindi word, sub means all, right? All matas means, mata means mothers. So all mothers are female, right? All mothers are female. So sub mata centric, all female are X chromosome. That was the All India question, right? So all females are X chromosome. This was the question in All India exam. Okay, what are the X chromosome? Submetacentric. So submetacentric chromosomes, X chromosomes are submetacentric chromosome, right? So this is the second type of chromosome. Third type of chromosome, third category of chromosome is acrocentric chromosome. Acrocentric chromosome. Acrocentric chromosome, when you will see how they will be looking like, acrocentric chromosome, one arm will be very short and centromere will be at one end and long arm will be very long, right? So here we can see that long arm is very long in comparison to the P, and centromere will be at extreme end. Centromere will be at extreme end. So now we are seeing centromere is at extreme end and long arm is very long. So these are called as acrocentric chromosome, right? Acrocentric chromosome, who are the acrocentric chromosome? This was the All India question in 2016, right? What are the acrocentric chromosomes? So to remember acrocentric chromosome, first I will tell you few important things. Number one question which was asked in All India 2014, कि Y chromosomes are acrocentric chromosomes. So this is another important point we have to keep in mind. Y chromosomes are acrocentric chromosome. This was the All India question in 2014, right? So Y chromosomes are acrocentric chromosome. What are other chromosomes which are acrocentric? To understand these things, we need to understand one thing, कि acrocentric chromosomes are associated with Robertsonian translocation. Associated with Robertsonian translocation. So acrocentric chromosomes are associated with Robertsonian translocation. Robertsonian translocation, right? So this is kind of a associative mnemonic where we are going to associate multiple things to remember one certain point, right? So we are associating acrocentric chromosomes are seen in Robertsonian translocation, and Robertsonian translocation is associated with pathogenesis of Down syndrome, right? So Robertsonian translocation is associated with pathogenesis of Down syndrome. What is Down syndrome? Down syndrome is trisomy 21, right? Trisomy 21. So acrocentric chromosome is Robertsonian translocation, associated with Robertsonian translocation, which is involved in pathogenesis of Down syndrome. So that is very, very important. So what kind of translocation in Down syndrome will be seen with the chromosome number 21? So in Down syndrome, chromosome number 21, these are the three translocations: chromosome number 21 to 21, chromosome number 21 to chromosome 22, chromosome number 21 to 13, 14 and 15. So these are Robertsonian translocation. 21 to 21, 21 to 20, 13, 14, 15. This was the All India NAMS question in 2012, right? Okay, what are the translocation you will find in Robertsonian translocation of Down syndrome? So Robertsonian translocation of Down syndrome, answer was 13, 14, 15 to the 21 and all of the above. So like that, examiner had asked this question. So that is why I wanted to let you know that. So now we can see that there are total 5 chromosomes: 13, 14, 15, 21 and 22. So these are acrocentric chromosome. So now we can understand total 6 acrocentric chromosome, including Y chromosome, right? So 13, 14, 15, 21, 22. All these are acrocentric chromosome, right? All these are acrocentric chromosome which we are seeing in this case, right? So these are all acrocentric chromosome which are associated with Robertsonian translocation, which is associated with pathogenesis of Down syndrome, right? So these three types of chromosome which we have discussed so far, they are associated with human being. The fourth type is called telocentric chromosome. Telocentric chromosome, where centromere is at one end, there will be only one arm. So one centromere and one arm. So this is not seen in human being. Not seen in human being. Not in humans. Right? So these are called telocentric chromosomes. So telocentric chromosomes are not present in human being, and that is the important thing we have to keep in mind, right? So these are the four types of the chromosomes which we have to understand, right? Now we will see the chromosomal abnormalities, right? Now we will see the chromosomal abnormalities as we have discussed, right? So chromosomal disorders. Chromosomal disorders, we can divide them into two categories. Chromosomal disorders can be structural disorders. Structural, so structure will be defective, that is a structural disorder, and second will be numerical disorder, right? So structural and numerical chromosomal disorders, right? So structural and numerical chromosomal disorders will be present in chromosomal disorder category. Structural means structure will be having some defect. So what are the structural disorders? We will see in a chromosomal disorder. So what are the structural disorders? We will discuss some of the important one. In number one, structural disorder is the deletion of the chromosome, right? Deletion of the chromosome. One end of the chromosome will be deleted. For example, I am showing you, this is the chromosome area, and suppose this area is getting deleted, right? So this is called as deletion. So deletion of the chromosome is structural disorder, right? And deletion are associated with many cancers and leukemias, right? So they are associated with cancers and leukemias, right? This is called deletion. Second thing which I want to tell you about, ring chromosome. Ring chromosome. What is ring chromosome? This can be a future question because this was the option given in AIMS 2013, right? What are the ring chromosome? If you recall the older concept, when we were studying the first chapter, what we have studied, ki chromosomes and their ends are having telomeres. Chromosomal ends are having telomeres, and telomeres are protecting them from fusion and degradation, right? Chromosomes are having telomeres at their end which are protecting them from fusion and degradation. But when there is a deletion at the terminal ends, so suppose I am showing you, these are the areas where they are having deletion. So because of the deletion at the end of the chromosome, telomeres will be lost, and as a result, what you will notice that chromosomal ends had been fused together. Chromosomal ends have been fused together like a ring. Now they are looking like a ring, and that is why this is called as ring chromosome. That is why it is called as ring chromosome. And ring chromosome will be demonstrated by small r in karyotyping. So ring chromosome is a small r, and there will be no arm because you can see all arms are fused together, so there will be no arm. Ring chromosome will be demonstrated by a small r, and ring chromosome is associated with sarcomas, pathogenesis of sarcomas, and Turner syndrome, right? So they are associated with sarcomas and Turner syndrome. So Turner syndrome was JIPMER question in 2015. Ring chromosomes are associated with Turner syndrome. When we will discuss Turner syndrome, then I will tell you about this question also, right? Now coming to the another chromosomal structural disorder, that is the third one, which is called isochromosome formation. Another important topic for All India and AIMS exam. Isochromosome formation, right? So what is isochromosome? What is isochromosome? How it is formed? So that is important to understand. For understanding this, I am just demonstrating one chromosome, normal chromosome. This is the short arm P and P dash, and this is the long arm Q and Q dash, right? Normally chromosomes, they divide in a vertical axis. See what I am saying? Normally chromosome, they divide in a vertical axis. like this. So normally chromosome divide vertically. So this is vertical. So this is the normal division. So this point we have to keep in our mind. Okay, normal division is the vertical division. So this is the normal division, which we can also call as vertical division. So normally they are dividing vertically. So vertical division is the normal division, right? But when examiner had asked this question was like this. In AIMS exam 2013, question was, if a chromosome is dividing perpendicular to the normal division. See, this is a question language, perpendicular to the normal division. So that time you should know that normal division is the vertical division. So what is perpendicular? What is perpendicular? Perpendicular means horizontal division. So this is the perpendicular division, which we can also call it as a horizontal division. So vertical division is the normal division and horizontal is not normal. So because of the horizontal division, this chromosome will be forming, both the smaller arms will be together, right? And both the longer arms will be together, right? So when we are seeing such type of chromosomes, these are called as isochromosome. These are called as isochromosome. And this was the answer in AIMS exam. So when a chromosome is dividing perpendicular to the normal axis or normal division or horizontal division, they will be forming isochromosome. And that was the answer in AIMS exam, right? So isochromosomes are formed when a chromosome is dividing horizontally or chromosome is dividing perpendicular to the normal division. Isochromosome is also denoted by a small I, right? They may have short arm or long arm. Here, why isochromosome is important for our future exam? Because examiner can ask multiple questions here. Question number 1, which is the most common isochromosome in human body? Most common isochromosome in human body is isochromosome XQ. So this long arm is the most common isochromosome, right? So most common isochromosome is IXQ. So most common isochromosome is IXQ. And what are the future question examiner can ask from here, right? The future question which examiner can ask here, the second thing, what is the most common isochromosome in human cancers? In human cancers. So in human cancers, it is isochromosome 17Q. Right? Easy to remember. Isochromosome 17Q. How we'll remember? Why I said it's easy to remember? Because most common gene mutation in cancer is p53, and location of p53 is chromosome number 17, short arm. Right? So this is the hint for understanding that 17 arm is affected, but short arm is with the p53 and long arm is associated with isochromosome. So chromosome number 17Q is most commonly associated with malignancies. Human malignancy can be a future question. Why it can be a future question? Because this I17Q is a basis of modern classification of one brain tumor, and that is given in Robbins, can be a future question also. I17Q is a basis for classification of which brain tumor? Answer will be medulloblastoma. So medulloblastoma classification, you will find involvement of I17Q. So in simple words, isochromosome 17Q is associated with which brain tumor? Medulloblastoma, right? Another important question which examiner can ask from this isochromosome is isochromosome 12, short arm, I12P is associated with seminoma, or you can say associated with germ cell tumor of testis and ovary both. So this is another important point which we must have in our mind for future exam point of view. Isochromosome 12P is associated with seminoma or germ cell tumor of the testis or ovary. So this is the significance of the isochromosome, and that is how we can predict कि future question can be asked from these isochromosomes which we are understanding here, right? So these are the structural abnormalities. Now we are going to see numerical abnormalities of the chromosome. Now we are going to see numerical abnormalities of the chromosome. In numerical abnormalities of the chromosome, we should understand few important things. In karyotyping, what is the most common numerical abnormalities in human being? Right? So karyotyping, what is the most common chromosomal abnormalities? So most common chromosomal abnormality is the trisomy 16. Remember, trisomy 16 is the most common chromosomal abnormalities. It is not trisomy 21, right? It is not trisomy 21, so do not have that confusion. Most common chromosomal abnormality is trisomy 16, right? And trisomy 16, mostly they will not survive, they will die in utero. So that is why when language is most common chromosomal abnormalities in live births, then your answer should be trisomy 21, which is Down syndrome. Then your answer should be trisomy 21, which is called as Down syndrome, right? So most common chromosomal abnormality trisomy 16, most common chromosomal abnormality in live births will be trisomy 21, right? Here what we need to understand that these chromosomal disorders which we are studying with the help of karyotyping, right? So karyotyping is a method, right? Karyotyping is a method where we study all these chromosomal disorders, right? But here we have to understand what are the limitations of the karyotyping. Very important point to understand and very crucial for exam point of view also. When we are talking about karyotyping is used for diagnosis of chromosomal disorders, right? So it is used for diagnosis of the chromosomal disorders, but they are having certain limitations. So what are these limitations of the karyotyping? Limitations are three important limitations. Number one, they cannot detect complex translocation. What is the complex translocation? Example is translocation 922, which we see in CML, right? In chronic myeloid leukemia, translocation 922. So these are complex translocation which cannot be visualized by routine karyotyping, right? Second thing, what we need to understand, it cannot be detecting, right? Karyotyping cannot detect amplifications. So karyotyping cannot detect amplifications, right? So it cannot detect amplifications. What are these amplifications? Amplifications are like N-MYC amplification. If you remember, N-MYC amplification which we see in neuroblastoma, right? In neuroblastoma we see N-MYC amplification cannot be detected by routine karyotyping. And the third thing is the microdeletions. Microdeletions cannot be detected by routine karyotyping. So these are the three basic limitations of the routine karyotyping. They cannot detect complex translocation, cannot detect amplification, cannot detect microdeletion. Mind the word, mind the language. Microdeletion cannot be detected, but deletion can be detected. Remember my words, what I am saying. Deletion can be detected, but microdeletion cannot be detected. What is the most common microdeletion known so far in our human race? So in human race, most common microdeletion syndrome is Diger syndrome. So Diger syndrome is the most common microdeletion syndrome where chromosome number 20q is having deletion like this, right? So microdeletion can be detected, cannot be detected by the karyotyping. So these are the limitations of the karyotyping. So how we can overcome? So these are the limitations. So how we are going to see that complex translocation or amplification or these kind of microdeletion? So how to overcome all these? How to overcome how to overcome these limitations. To overcome these limitations, we can use two more technique, which is called as fluorescent in situ hybridization, right? Fish. Fluorescent in situ hybridization is superior to polymerase chain reaction. So that is important to understand. To overcome the shortcomings of the karyotyping, we can use fish or PCR. Fish will be always superior, which will be best for identification of the complex translocations or micro deletion or amplification, right? Now we will see some of the important points about this fish versus PCR. What is the utilization of the fish? Fish is the best method. This was the AIMS question in 2013. Best method for detection of known gene loci. So known gene loci is best detected by, that was the question in AIMS 2013. Known gene loci is best detected by fish, right? This is the limitation. So now you see what is the limitation of the fish. Fish is also having limitation. What is that limitation? Fish cannot detect a smaller gene. Cannot detect a smaller gene. Right? So fish cannot detect a smaller gene. That is the problem with the fish. So point mutation cannot be detected by fish because they are smaller gene mutation. So what will be the ideal method for detection of the point mutation? That was question in AIMS 2013. So after 6 months of this question was asked, and PCR is the best method. So remember, PCR is the best method for detection of point mutation. So PCR is the best method for detection of point mutation, right? So PCR is the best method for point mutation. This was the another important AIMS question. For point mutation, what is the best method? Polymerase chain reaction. But this PCR is also having limitations. PCR is also having limitations. What is the limitations of this polymerase chain reaction? PCR limitation is larger genes. So larger genes cannot be detected by PCR. So now we can see that fish cannot detect a smaller gene and PCR cannot detect larger gene. Here I would like to tell you one important thing. How we can overcome limitations of both fish and PCR. See, what is the question now? What examiner is going to ask question in future exam to overcome the limitation of fish and PCR? How to overcome this limitation? Or examiner can ask question like this, what is the best method to detect both smaller and larger genes at one time, means simultaneously? Or examiner can ask you the question, which is the best method to overcome limitations of fish and PCR, right? So what is the best method to overcome this fish and PCR limitations? That is MLPA, multiplex ligation associated probe amplification. So what is this? Multiplex ligation associated probe amplification. So this method is called as multiplex ligation associated probe amplification. So multiplex ligation associated probe amplification is the best method to overcome shortcomings of the both PCR and fish, right? So here I will give you example, because the basic principle, if you talk about the basic principle, what is the basic principle of this MLPA? So basic principle of MLPA is combining the principle of fish and PCR. So both fish and PCR principles are combined, and then we see a principle of MLPA, right? So MLPA example, there are two examples I want to give you. Number one is Duchenne's muscular dystrophy. Duchenne's muscular dystrophy. So Duchenne's muscular dystrophy, and second disorder is the cystic fibrosis. Cystic fibrosis. So these are the disorders where we are going to utilize MLPA, because in both disorders gene involved will be having multiple exons, which will be shorter segment also and a larger segment also. So that is why both short and large segment of genes simultaneously detected by which method? Answer must be MLPA, right? So this is how we will overcome the limitation of FISH and PCR, right? Now we will move to the structural numerical abnormalities of the chromosome. In numerical abnormalities of the chromosomes, numerical abnormalities of the chromosomes, we will deal with the certain numerical abnormalities. For example, if you remember, I said कि micro deletion can be detected, but deletion cannot be detected. Deletion can be detected by karyotyping, but micro deletion cannot be detected, right? So deletion example is number one. Deletion example which I want to give you here is the Cry-Du-Chat syndrome, right? So Cry-Du-Chat syndrome is due to deletion of chromosome 5 short arm. So minus sign is for deletion. So chromosome number 5 deletion is Cry-Du-Chat syndrome. Cry-Du-Chat syndrome, what will be the feature of this patient? Patient will be having a mental retardation, right? Developmental delay, and the most important thing, the name itself is telling Cry-Du-Chat. So what is this characteristic? It's a cat-like cry, right? So high-pitched cat-like cry. That is why this name is given, right? Cry-Du-Chat syndrome, because they will be having cat-like cry, right? So high-pitched cat-like cry will be there, which we also call mewing, right? So mewing will be there. So cat-like cry, high-pitched cat-like cry or mewing is this seen in Cry-Du-Chat syndrome, and that is why this name has been given, Cry-Du-Chat syndrome. So deletion can be detected, right? So this is the example of deletion. Then we can see some numerical disorders which are associated with autosomes, right? So there are disorders which are associated with the autosomes, right? And there are certain disorders which are associated with the sex chromosomes. So we will discuss, right? So autosomal disorders and sex chromosome disorder. Autosomal disorders, I will just put some names here, which examiner had asked like this, what is trisomy 21? What is trisomy 21? We know that this is the Down syndrome, right? This is the Down syndrome, trisomy 21. Another autosomal disorder which examiner asked in exam is what is the trisomy 13? This was the all India question. Trisomy 13 is also known as Patau syndrome. Trisomy 13 is Patau syndrome, and trisomy 18 is known as Edwards syndrome. 18 is called Edward. E for 18, E for Edward, right? So this is Edward syndrome. So trisomy 13, trisomy 18, trisomy 21, all these are the autosomal disorder. In sex chromosome disorder, we will discuss about Turner syndrome. We'll discuss about Turner syndrome. We will discuss about Klinefelter syndrome. Klinefelter syndrome, right? So these are the autosomal and sex chromosome disorder which we are going to discuss in next